Hello, so today we're going to be talking about formulations and their role in dementia care in treating behaviours that challenge. Behaviours that challenge, such as shouting, excessive walking, agitation, aggression, are often a sign that the person with dementia is experiencing some kind of distress. These types of behaviours can be treated with medications, however they're not always effective and can come with some serious side effects. So how do formulations help solve this problem? We can use formulations to understand the underlying causes of somebody's behaviour, and then we can treat this cause, reducing the need for potentially problematic medications. So what is a formulation? A formulation is a framework which helps us gather information in a meaningful way to identify patterns in behaviour, which can help us understand the causes of behaviours that challenge. As social animals, humans are constantly trying to find patterns in behaviour automatically. We're always trying to understand others and figure out why people behave the way they do. However, when a person develops dementia, families and professionals often stop using their normal pattern detecting skills and instead attribute every behaviour to dementia. This is where formulation comes in. It prevents us from making these assumptions by guiding us to consider all the reasons a person might be displaying behaviours that challenge. So when we're using formulations, how do we make sure they're meaningful? We need to consider two things: what information we gather, and how we gather it. When we're thinking about what information we want to include, we want to make sure we collect enough that we understand the behaviour, but not so much information that it becomes overwhelming and too complicated. The best formulation helps us find this balance and guides us to collect the smallest amount of relevant information that still allows us to fully understand the behaviour and devise appropriate solutions. The sort of information collected may include the environment, personality, life history, physical and mental health, and needs which we want to meet. But how do we best collect this information? The quickest way is to get somebody who's experienced in formulations to fill in the boxes using patients' files and brief conversations. However, from years of practice, we know this is ineffective, and it's far more meaningful if those close to the person are involved in constructing the formulation. There are two reasons for this. Firstly, these are the people who can give the best, most in-depth information, which can help us gather a better understanding of a person's behaviour. Secondly, the formulation process can emphasise to loved ones that a person with dementia may not be able to change their patterns of behaviour, and so it is everyone else in the environment who has to change in order to resolve behaviours that challenge. So in summary, formulations are a way of gathering information about a person in a structured and meaningful way. They draw on our pattern detecting skills and guide us to understand the underlying causes for a person's behaviour and inform treatments. The best formulations will guide us to collect the smallest amount of information needed for a good understanding and will involve loved ones in the process. Thanks for watching, and we hope you found this video useful.